see most patients a day after surgery. Right off the bat, we go ahead and start 4 exercises. These exercises are crucial to a good recovery with a knee replacement. The first exercise is ankle pumps. This exercise is recommended about every hour, and you should be doing somewhere between 10 and 25 of those. What this looks like is you're going to be laying down on your bed or your couch or recliner, and you're going to be tapping your toes up and down. Very basic exercise. You do want to do both feet with this. What's happening with this is your calf muscles pumping up and down as it moves your foot. It's pumping your blood, getting your circulation going. This is really good to prevent blood clots in the leg. So about 10 to 25 of these. That should be about every hour that you're doing this. Again, you can do this in a seated position. You can do it laying down on a bed, couch, or a recliner. Best position to do this in is actually with the leg elevated in the air on a couple pillows, tapping the toes with that. But again, about every hour, this should be done anywhere from 10 to 25 reps. The next exercise that's important immediately following a knee replacement is called the quad set. Quad set is to be done about every hour as well, and usually I recommend about 10 reps for this. For the quad set, your leg's going to be straight out. You're only going to need to do this really on the surgical leg. What you're doing is you're pushing your knee down into the bed, the couch, the chair, whatever you're in. You're going to put the knee down in, hold for 1, 2, and relax. Push the knee down, hold for 1, 2, relax. You're going to feel the muscle on top of the thigh here tighten up, and this is going to wake this quad muscle up. This is not going to stress the knee very much at all. It's a pretty low stress exercise, but it is going to wake the muscle up, allow you to be able to start lifting the leg easier, be able to stand from a seated position easier, perform a lot of the exercises in the future a lot easier. Again, this is called a quad set, and this should be done about 10 reps, about every hour. The other 2 exercises we start right off the bat are stretching exercises. And these are probably the most important exercises you can do following a knee replacement. So these stretches help us get the knee as straight as possible and as bent as we can get it. The third exercise then is the knee extension or the straight leg stretch. So the straight leg stretch typically is best to be done while you're laying on a bed or a couch as well. What you're going to do for this is you can just take a regular pillow, fold this guy up. You're going to lay on down, and you're going to let that leg hang on that pillow. As you can see in this position, the leg is braced at the ankle or the foot, and the knee is trying to hang downwards. Gravity's pushing that down, and it's straightening that knee out. This is going to be fairly uncomfortable when you're doing this. The further you can push that pillow out, the more stressful that will be. So if I've got it out further here, you can see my knees hanging a little stronger. Versus if I'm trying to do this and this is way too uncomfortable, I can slide the pillow up closer to my knee. The biggest thing is you don't want to have it close enough to the knee that it causes the knee to bend. For this here, we're going to be doing this for about 5 minutes. And you're going to try to do this at least 3 to 5 times a day. So again, you're doing this for about 5 minutes, 3 to 5 times a day. You can always do more than that. This is typically best to be done laying flat in a bed or on a couch. You can do it in a recliner. It's a little more difficult because if you're in a reclined position, you really have to get that knee up to stretch, and then it's also pulling on muscles in different locations that aren't as imperative or not as helpful rather for getting this knee stretched out. So this is probably the best position to do this in. Another way to do this is if you're sitting in a chair watching TV, you can even take an ottoman and kind of prop it up at the end of the ottoman and let the knee hang in that position, stretching as well. 5 minutes, 3 to 5 times a day for this one. The fourth exercise and the second stretch we give immediately after surgery is the knee bend stretch or the knee flexion stretch. This one here, our goal is to allow that knee to come back and bend as far as you can. Typically, we recommend a standard chair for this when you're stretching, just because it gives you a little more support and stability with the stretch. With this here, you're going to try to bring your leg back as far as you can while you're seated. You can either grab the leg and try to lift it up and pull it back, You can use your good leg or your non-surgical leg to try to push it back as far as you can. Or in a seated position, you can keep your foot still and try to scoot forward, allowing that knee bit to bend forward. This is going to be a pretty uncomfortable stretch. There's some ways that the no pain, no gain doesn't apply always in therapy, but this is one area where it does apply. You do need to push through some discomfort in order to get that knee stretching and bending. Not going to damage the knee joint. It certainly is going to feel like it, but this is just muscle and potentially some scar tissue that you'll be pushing through when you do these stretches. And it's something that is very imperative immediately after surgery. With this here, we typically recommend pulling back, holding for about 30 seconds. I would recommend using a stopwatch or a timer on your cell phone just to make sure you don't cheat yourself. That 30 seconds goes by pretty quick when you're keeping track in your head. After 30 seconds, you're going to slide that leg back out. Going to let it relax for a bit. Then you're going to go right back into it again. We recommend this 5 times in a row, and then about 3 to 5 times a day you're doing this whole sequence.